In the final analysis, of course, a successful healthcare system will be reflected in key indicators like under 5 mortality, infant mortality rate, maternal mortality rate, and life expectancy and birth. If you look at the indicators given in the book, even within South Asia, Pakistan is behind Sri Lanka and India on most of these indicators, despite the upsurge in some resources, domestic and external, that were devoted to this sector in the last 5 years. Let us hope that choke pipe will spur not only policymakers but all stakeholders into more effective, integrated and meaningful action to provide better health and better health care to the citizens of the country. Well done, sir.
Thank you very much, sir. Ending on that positive note. There's definitely that sense of hope that emerges from choke pipes, and the hope is that eventually the state will develop its capacity to strengthen its system pipes, which can then serve as vehicles for delivering healthcare and streamlining the conduits for targeting welfare of the people of Pakistan. Dr. Sanya Nishtar, the author, has emerged over years as one of the most potent and respected, internationally acclaimed voices representing the health sector in Pakistan. I invite her to speak.
Honorable panelists, Mr. Sardar Aziz, Mr. Ishrat Hussain, Mr. Jaz Rahim, our dear friend and a very good friend of Pakistan, Dr. Khalid Bide, Amina Sayyed. Thank you so much for your comments. I've been greatly humbled indeed. And I'd like to thank you for the time and effort that you've taken to go through the book and for your very valuable comments, which we look forward to consolidating and archiving and putting on our website. I'd also like to thank the audience for the time that you've taken out to be here with us. I realize there are many competing priorities on a Thursday afternoon. I've never seen more luminaries and more stellar names in a gathering. So thank you all for being here with us and for lending us your support. I'm extremely encouraged and very humbled by your presence and by the comments that have been made. I have a long list of thank yous, but before that, I guess I have to say something about the book. And I thought I'd like to talk about the two motivations that I've had to write this book. One of them was domestic and the other were related to my work in global health. With reference to Pakistan and the agenda for reform that I've attempted to articulate within this book, I'd like to project it to a broad context. And I think the broad context for me is that Pakistan is undergoing very troubled times. There are many internal and external national security threats. There are the realities of globalization that the country has very limited capacity to cope with. There are fiscal space constraints within the country, and these will be compounding by the global financial crisis that the world is just recovering from. There will be a change in global systems of governance, and we have limited capacity to cope with these problems. And on top of all that, the need to target welfare to the people of Pakistan has never been more dire as it is right now. And opposed to all these realities, the capacity of the system to target welfare to its citizens is very weak and has been very badly eroded over the years, as the panelists have very rightly indicated. So this book and the reform agenda that I have experimented with in a way in terms of its articulation is a very humble attempt to put forward something in black and white with a view to lending impetus to a renewed dialogue, to new strategic thinking about the need to look at things in a very different way, and about the need to leverage and harness all resources of the economy towards the goal of development, about leveraging the outreach of private providers, about partnerships to deliver welfare to the people of Pakistan, because the need to do so has never been more dire, it has never been more acute. What I'm trying to say in the book with reference to the health sector essentially has been dilated upon very capably by our eminent panelists. Essentially what I'm saying is that there are factors outside of the health system which influence health status. If you look at how infant mortality rate has gone down in the Asian tiger countries, the single most important factor has been maternal level of education. And per capita income per se is one of the strongest determinants of health status achievement. Then there are additional impacts of fiscal space, there's the overall capacity of governance, the overall environment of transparency, which has a very direct correlation with the performance of the system and the manner it impacts outcomes. And all these considerations very critically impact the performance of the health system, indeed any other system. And by trying to make these points and by linking it to other issues which relate to Pakistan's federal structure, the relationship between the federal government, the provinces and districts, this whole unfinished agenda about the devolution initiative and the manner in which it impacts district governance, the issue of concurrency and so on and so forth, the issue of civil service reform and broader measures that are needed with reference to institutionalizing transparency, are some of the considerations which are impacting health status, as impacting the performance of social sectors, indeed as impacting the performance of any other sector. And by bringing them to the fore, I've tempted to make the point that reform has to have a holistic orientation. There is not the time now to tinker at the margins and to be wasteful with resources in the process. That's one of the things that I wanted to communicate, and from the remarks that the panelists have in their wisdom and what they've made, I seem to get the sense that I have been able to communicate this very clearly. Within the space of the health sector, I've tried to conceptualize a reform agenda, and that again is based on certain pragmatic realities. So I'm not campaigning for something that's not doable. I've tried to advocate to broaden the base of public means of financing. I've tried to talk about management re-engineering of of the state's health system and how it can revitalize its own system by leveraging the outreach of private providers and through management engineering in many different ways. I've talked about the role of technology and how it can plug gaps and leakages in many areas, and how it can facilitate information dissemination and continuing education. And then I've talked about the medicines section, and that has been a very difficult piece to write. And I finally thought about taking the issue of spurious drugs as a peg to dilate upon the issue of quality regulation, and then I've talked about price and intellectual property rights regulation as ancillary pieces. And then there are, of course, other chapters, because there are six subject domain chapters and all. And towards the end, I didn't want to end on a theoretical note, and I thought it would be good if I consolidate it into an action plan and phase it out so that it could lend impetus to a very concrete and substantive dialogue on the next steps, should somebody decide to base changes on whatever has been proposed. So this is basically what I try, this basically is what the analysis pointed out. But in coming to a conclusion with reference to the reform side as it relates to the health sector, there were three painful realizations, and I must share those with you today. The first of them related to the fact that in Pakistan, at least in the health sector, which is what I'm a little familiar with, everything has been tested. But with change of governments, things are rolled back, policies are sidelined. There's absolutely no continuity of policy direction. And this has nothing to do with a particular administration or with a particular government or with a particular political party. This is the way the system works. There is no, as a result of lack of continuity of policy direction, it is extremely difficult to institutionalize reform. And I get a sense that this particular systemic constraint is not specific to the health sector. It is across the board in all the state systems. The other painful realization that I had was the complex nature of reform. Reform in the health sector is not something in isolation. You just cannot tinker at the margins and make some technocratic changes and completely ignore what is needed in the space of restructuring frameworks, broadest frameworks of governance, civil service structures, frameworks for public-private partnerships. You cannot be blind to the need to look at broader frameworks that ensure transparency within the system, and others that ensure the functioning of the state at a broader level, this whole issue of separation of powers, the relationships within the federation, and so on and so forth. And again, the capacity within the system to take on complicated reform agendas, cascade them over a period of time, have the level of integrity and oversight to see them through and to see them coming to fruition. And the lack of that has, in a way, been a painful realization for me as I analyzed and as I looked at documents. I've never worked in the public sector system. I come from the private sector. And for me, analyzing these documents and sifting through them and getting to see what all that has happened and all the monies that were spent in the process, and for those things not to have come to fruition was extremely painful as I wrote the book. That is one side of the story, and I think as a concerned citizen of Pakistan, this is how I would like to describe myself in a situation where the country is undergoing extremely turbulent and troubled times. I thought this could be my humble contribution, and that is one side of the picture. There is another side of the picture also. 95% of my professional time is spent on aircrafts, on different committees and on different boards that I work with in the space of global health. And in the space of global health, there is a transition that some of us are lending impetus to and that some of us are advocating for very heavily. That transition has to do with a move from diseases towards systems. Because in the space of global health over the last 60 years or so, there has been a focus on diseases, focus on eradicating malaria and tuberculosis and smallpox and polio, and those are extremely important endpoints to meet in their own right. But the world is now getting to realize that unless you cater to the systemic constraints that act as impediments in the way of achieving those outcomes, the world is not going to make a major headway. The WHO representative can tell you that Pakistan is one of the 4 countries in the world where polio stands uneradicated, and that it's the same situation with our neighbor to the east.